Medication and DPDR. 1. You are coming to me because of my track record for getting lasting improvements and cures with DPDR. I need you to be able to feel your feelings and emotions in order to be able to change them through intervention techniques. I don't need you to be on any medication. I don't see any advantage to being on medication. It only muddies what you can feel, and people with DPDR already experience a distance to their feelings, so more distance is certainly not going to be advantageous to me. Next, what can you learn from a pill? Think about this. How can you cure the cause of DPDR with a pill? And also, how are you going to learn to deal with your emotions and to learn to self-regulate some of your issues through a pill? I don't see it. Let's think about the idea of a cure. What is a cure? If you have a biological infection, some bacteria, and you take an antibiotic, you'll notice that the antibiotic actually kills the bacteria and that you are cured. Think about the DPDR and a pill. In the best case, you get to feel a little better when you're taking the pill. In other words, it's not a cure, it's more like an addiction. And lastly, I am not a doctor. Medication is his business. It's none of my business, literally. I have no advantage to having you on medication. He may actually have an advantage. He probably gets money whenever he prescribes pills. A doctor has an agreement with you if you accept the pills, that it's an agreement between you two. And it's none of my business. The question is, what do you want? Now, if you're already on medication and you're not happy with it, going off medication is still part of the agreement between you and the prescribing doctor. So to get off of them, you need to go back to that same doctor. I am not a doctor. You need to taper off wisely. Never abruptly stop medication. Especially the benzos and the antidepressants, the strong ones. You need to taper off them wisely. Coming back to my position, I'm a therapist. I cure DPDR through intervention techniques. I also cure anxiety and panic disorder and depression through intervention techniques. I don't need any medication. That's it. Have a good day. Think about it. What's the message your doctor is sending home to you when he says you need medication? What's he really saying? If you already know that your doctor isn't capable of curing you, what's he doing with the medication?